of Healthy Women, the leading not-for-profit women's health organization addressing all women's health issues from A to Z. Innovation in healthcare means not only the research, but how we're taking that research and providing it to consumers to best meet their needs, whether it's technology, increasing content and the way we provide that content on our website, and making it accessible 24/7. Healthy Women, as far as innovation in women's healthcare, has really progressed. We used to be a toll-free number and a newsletter. That's how we provided women with health information, but we've evolved in now creating one of the top women's health websites that provides women with information resources that are medically vetted, taking current research and making sure that it's written so that consumers can understand it, and providing all the great resources, links, and tools that women need to make an educated and empowered decision on their health care.
My name is Linda BULONE. I'm the Research Nurse Manager at Queens Hospital Cancer Center. Innovation in healthcare means to me to have patients live better, longer, and stronger in terms of their treatment and their care. And no matter what economic background, what language a patient speaks, they should get the best healthcare possible, and they should live as best as they can.
Innovation in healthcare to me means not only is it about healthcare, but more specifically in women's healthcare, it means that we not only include women in those perspectives, but that we also talk to her and her family and her partners, her children, because more and more across the country we're spanning cultures and we're spanning generations. And women happen to be the chief medical officers of their homes and their circles. So when we can translate that into not only being relevant to her, but being relevant to her partner, her parents, and her children, that's when we can be truly innovative.
The numbers are that you have half the US population goes to an emergency department every year as a patient or a visitor. On average, they spend about 4 hours in the emergency department, of which time they see a health professional for 20, 30 minutes or so. And the research associates would enroll participants in those studies. But also there was time when they were kind of hanging around. You know, there's only so many ankle injuries you get on any one 4-hour shift. And so one of our chief research associates, Heather Sibley, who's now a emergency physician in Connecticut, had the idea of taking that time when the RAs were kind of looking for other people to be in the studies and apply that by having them ask primary healthcare questions. And that's where we've started to develop this whole research interest that NARAP is tapping into. As we expand NARAP, starting with 10 hospitals, we'll be going to 15 hospitals for the colon rectal cancer screening study. We'll be in the end of 2015, we look to have 20 hospitals. By the end of 2020, the business plan is for us to have over 100 hospitals. We think this model can be expanded so that if you're a hospital within 30 miles of a college that has people who want to go to health professional school, go to medical school, that you can have research associates at no cost who are tremendous with your patients and can get us valuable data, but can also perform the kinds of primary health care and facilitate the kinds of primary health care that can really make a change in how we do that nationwide.
I'm Rebekah ROTSTEIN, and I'm an ambassador for American Bone Health and the creator of Buff Bones. Innovation in women's health care to American Bone Health means staying tall, strong, fracture-free, able to care for kids and grandkids, and to be role models for healthy living. American Bone Health will be doing posture and balance screenings and showing exercises from the Do It Right campaign. I was diagnosed with osteoporosis when I was 28, so I have a very personal interest in this, especially an affinity for organizations like American Bone Health that put out information and knowledge to people with osteoporosis.
Innovation to AMWA is viewing science and medicine through an innovative lens, thinking outside of the box and finding creative solutions to the specific healthcare needs of women, embracing new scientific data and helping to translate the findings of research to the treatment of patients, and understanding that changes in healthcare begin with the education of students, physicians in training, and practicing physicians.
Cervical cancer could be completely eradicated if women got pap smears. Completely. Which is, there's few other cancers that could be completely eradicated. Cervical cancer is one of them. And so we don't need a new cure for cervical cancer. We have to get women screened. For breast cancer, if we can get all women to do mammograms, we could cut the death rate from breast cancer to 5% rather than the 40,000 women per year that are dying of breast cancer every year in the United States. If you do colon cancer and you take out benign polyps, they'll never become malignant polyps, so you can certainly lower the rate of colon cancer in this country by doing colonoscopy, and that usually should be done every 10 years after the age of 50. And so the Health and Hospitals Corporation, which is the public hospital corporation of New York, has a program on to try to get people to do colonoscopy, and Queens Cancer Center and Queens Hospital Center are part of that program.